Hello, my dear aspirants. Welcome back to your channel, Nursing Concepts by Raghav. So, the exams are very near, hardly some around 20-22 days left for your prelim or stage 1 exam of the NORCET 10. I thought, why don't I take some topics which are helpful for the aspirants and the topics which are being repeatedly asked. So, that means every time there is a fixed question on these some topics. I have made gone through the previous question papers. There I've seen some topics which are being repeatedly asked. Definitely there is one or two questions usually strikes in the exam, so I thought of taking those topics in the upcoming days, so that it will be helpful for the real aspirants, those who are preparing for the exams. So in the today's uh, video session, I am going to discuss such one important topic, that is a shock. So here I am going to discuss the topic with the MCQs, so that you will understand better, like how the questions will arise from the topic, and how we should analyze the question, and how to interpret it and go for the right answer. So that all things we will study in the today's video session. So that is about the shock. Okay, so hope your study is going in a right direction. Let's begin with the class, and please do subscribe and watch the video till the end, because the questions what I have taken here are very important. Definitely you may expect a fixed question from this topic. One or two questions might be possible from this topic, that is shock. Okay, okay, here is the first question. A patient arrives in an emergency department after a road traffic accident with a heavy bleeding, and the patient's BP is 80/50 and pulse is around 120 per minute. So, which type of shock is most likely? Okay. So here in the question they have given some aspect you should note. One is the patient is with the accident, okay, RTA. Then there is a bleeding, heavy bleeding is there, and BP is around 80/50. So that means the patient is having the hypotension. So BP is not normal here, the patient is having the low BP or the hypotension. And the pulse rate, if you look at it, is 120 per minute. So that means it is more than 100, so it is tachycardic. So three important things they have given here. One is the hypotension, the patient is having hypotension, and the tachycardia, that is because of the bleeding. Okay, so these three important aspects it's given, and the question is asking which type of shock is most likely. Okay, see here, so to understand which type of a shock it is, let's understand what actually the shock means and what are the types of shocks we have. Then we can easily understand this question, and we can easily make out the answer. See, firstly, what is actually the shock? The shock is nothing but it's an emergency condition where it is caused by an inadequate blood flow to the tissues, and leading to the, means the, when there is inadequate blood flow means the oxygen also going less to the tissues, and leading to cellular dysfunction. So that is what we call it as a शॉक. सो शॉक इज नथिंग बट जब टिश्यू लेवल पे ब्लड सप्लाई कम होगा, ब्लड सप्लाई के साथ ऑक्सीजन का लेवल भी कम हो जाएगा टिश्यू लेवल में, एंड टिश्यूज या सेल्स का फंक्शन जो अल्टर हो सकता है इसकी वजह से, तो देन इट इज कॉल्ड एज अ शॉक. So majorly, so here what happens actually, see, decreased blood flow leading to decreased oxygen supply to the tissues. So what we call this, decreased oxygen level in the at the tissue level, there it is, we call it as a hypoxia. Okay, so the hypoxemia is different word. So hypoxemia means there is a decreased oxygen in the blood itself, but here the blood supply to the tissue, or the oxygen level at the tissue level, oxygen at the tissue level is less, so there it is called as hypoxia. See, when the oxygen level get reduces in the tissues, so the metabolism will differs. Okay, so there are two types of metabolism, as you all know, that is aerobic metabolism and the anaerobic metabolism. Aerobic means the metabolism which occurs in the presence of oxygen, and anaerobic means when there is less oxygen, means it will turns to an anaerobic without the oxygen, so the metabolism occurs. So the end product of these two metabolism is different. So with the uh, aerobic metabolism, we get a that is CO2, and even the water molecules are being, and energy molecules are being generated. So that is what the aerobic metabolism. So but in the anaerobic metabolism, when there is a decreased oxygen level, so the anaerobic metabolism takes place. So this leads to an anaerobic metabolism. Anaerobic metabolism. So this is what we call as a cellular dysfunction. So during the anaerobic metabolism, what the end product we get is the lactic acid. Lactic acid. So this lactic acid, which gets deposited in the tissues or in the cells, and leading to cellular dysfunction or even the cell death. So we call it as a, this condition we call it as the shock. Okay, see here, the major condition is the decreased blood supply. So there are so many conditions which can leads to the decreased blood supply to the tissues. See here, the possibilities are like maybe the blood level or the fluid volume is less. Okay, that is intravascular fluid is less, or the heart is not able to pump enough blood to meet the tissue level or the tissue requirements, or if there were any blockage so that the blood cannot reach, or if there is an abnormal vasodilation, and so that the proper venous drainage to the heart cannot be there. So there are different conditions, so that there you can expect a decreased blood supply and leading to the cellular dysfunction. Those all conditions we consider it as a shock. Okay, so the major two things you have to remember in the shock is, one is decreased blood supply or the decreased tissue perfusion we call. Okay, tissue perfusion in the sense the blood supply to the tissues is been reduced. So tissue perfusion, decreased tissue perfusion and the oxygen to the tissues leading to the cellular dysfunction, then it is called as a shock. Okay, see here, based on this, we have we majorly classify the shock into two major categories. Okay, shock is been classified into two major categories. One is a non-distributive non-distributive shock, and the distributive shock. Distributive shock. The non-distributive. The non-distributive means the blood is not abnormally distributed here. So means the blood volume itself is less, so that the tissues are getting the less blood supply. Okay, so those conditions, those type of shock we call it as a non-distributive. Whereas distributive, where there is a maldistribution of the blood, means the blood may be poured in the periphery, or there is an abnormal or distribution or abnormal vasodilation that will lead to the widespread or maldistribution of the blood in the periphery. So that is what we call as a distributive type of a shock. In the non-distributive, we have majorly the three types. One is a hypovolemic shock. Hypovolemic shock. Second is a cardiogenic shock, and third one is obstructive shock. Obstructive shock. Okay, so then in the distributive, again we have three types here. One is anaphylactic shock, and the second one is a neurogenic shock, and the third one is septic shock. So these are the three important topics, or the three important types from the distributive as well as from the non-distributive type. See here, there is a possibility of direct question may strike in your exam. They may give a certain type or the cardiogenic shock, which is which type of shock it is. Okay, direct question, non-distributive type. They may ask you neurogenic shock belongs to which category of or which type of shock. It is a distributive shock. So do remember this distributive and the non-distributive shocks classification. So you may get in the exam direct question on this. Okay, so you can make your own mnemonics. See here, you can remember it like a CHO. Okay, C stand for the cardiogenic, S stand for the hypovolemic, O stand for the obstructive shock, and here you can remember it as a ANS. Okay, that is anaphylactic, neurogenic, and the septic shock. Okay, so these are the different types of shock, that is distributive and the non-distributive shock. If first we'll see the hypovolemic shock. The hypovolemic means what? As the name itself indicates, hypovolemia means the volume is reduced. The intravascular volume is been reduced, or the body fluid volume has been reduced. So that is what we call as a hypovolemic shock. So this is also called as a cold shock. Cold shock. Okay. See here, why the hypovolemia occurs. So there are certain some reasons where we can see the hypovolemic conditions, like hemorrhagic conditions and the non-hemorrhagic conditions. The hemorrhagic, see here we have a two major causes, that is a hemorrhagic and the non-hemorrhagic. Non-hemorrhagic. See, hemorrhagic means where we can see the bleeding. So because of the excessive bleeding or the massive bleeding because of the trauma or because of the accident, so if the patient has a blood loss, heavy blood loss, then it is called as a hemorrhagic shock. So here we can take an example for the hemorrhagic shock, maybe due to trauma, or in the case of PPH, or in the case of GI bleed, or like in the post surgery surgical bleed. So if the bleeding happens and the blood loss happened, because of that the patient goes for a shock, then it is called as a hemorrhagic shock. And the non-hemorrhagic, see here in this, the body fluid volume has been reduced automatically, leading to the hypovolemia. See here the conditions like recurrent or heavy vomiting, diarrhea, then the burns, then pleural effusion, then ascites. See, in this all burns, pleural effusion, and the ascites, where there is a shift of fluid can be seen. See, means the fluid from the intravascular will get deposited in the extra cellular spaces. So because of that, the volume of the blood will get reduces and leading to the hypovolemia. So these are all the conditions where we can see the hypovolemic shock. See, come let's see the first question here. See, in the first question, what is there? Here the patient is having the traffic accident, okay, and patient is with the heavy bleeding. So the patient is having the heavy bleeding. So this itself will take you to the which type of shock it is. It is an hypovolemic shock. Okay, so and the BP is also less here, and pulse rate is 120. So we'll discuss the clinical features so that you will understand why there is an hypotension. See here, in the hypovolemia, what happens because of the decreased blood volume? So what happens? The blood volume get reduced, and the same the tissues or the when there is then blood volume is reduced, so what will happen? So the tissues will get a less blood supply, tissue perfusion decreases, and the metabolism, it will turns to an anaerobic, and leading to the lactic acid lactic acid get deposited or developed in the tissues. Okay, so this we call it as a metabolic acidosis. And in the similar way, when there is an less blood volume and even the cardiac output, so this will leads to an decreased cardiac output. Okay, so the cardiac output is been reduced, and because of that, and the tissues nutritional needs or the oxygen needs are not being met, so the compensatory mechanism gets activated in the body. So the heart starts pumping more in order to pump the more blood to meet the nutritional and the oxygen demand by the tissues. So because of that, decreased blood volume, will compensatory mechanism gets activated, and we can see the tachycardia. Tachycardia as a compensatory mechanism. See, as the blood volume is less, automatically the cardiac output is also less, and we can see the hypotension as well. Hypotension. So the blood is getting less to the tissue levels, okay, and the metabolism gets to an anaerobic, and as there is a decreased blood supply, we can see the periphery becomes cold, okay, the skin will becomes very cold, and tachycardia will be there, and later the pulse will become feeble. Feeble. See here, three conditions you need to focus on, that is tachycardia. See, tachycardia is a compensatory mechanism. Because of the compensatory mechanism, the heart starts pumping more in order to meet the, or to pump the more blood to meet the nutritional and the oxygen demand by the tissues. So because of that, we can see the tachycardia. So the tachycardia is considered to be the earliest sign, early sign of a shock, okay, that is especially in the hypovolemic shock. So early sign will be the tachycardia, and the later sign or the late sign will be the hypotension, okay, late sign will be the hypotension. So in order to increase the blood pressure, initially there is a vasoconstriction will be there, okay. So though there is, in order to improve the that is a cardiac output, or to increase the blood pressure, there we can see the vasoconstriction can be seen in this conditions. See, these two signs we have to note importantly in the hypovolemic shock, that is cold and clammy skin or the peripheries, tachycardia with the hypotension. So these symptoms are there, then it is an hypovolemic shock. So these are the very classical sign, that is tachycardia, hypotension, and periphery will become cold, and the clammy skin, and a pulse will become feeble in the later stages. These are the very important classical signs of hypovolemic shock, okay. So if these were there, then definitely your answer should go for a hypovolemic shock. So it is, as I told, that is also called as a cold shock, because the periphery will become very cold because of the decreased blood supply to the peripheries or to the tissue levels, okay. So these are the some important aspects of the, and as the BP goes down, and the patient will become mentally confused, or restlessness can be seen even in the patient. So these are the some important and recognizable clinical manifestations in the hypovolemic shock. So how do you manage the hypovolemia cases? So here the volume is less, then automatically the first management goes to the improving the fluid volume. Means that is fluid resuscitation should be done. Okay, so coming to the question here, the first question. Okay, so the patient in the emergency department, as I told, the patient is having the heavy bleeding, a BP is again, hypotension is there, then the tachycardia is there. So I told you bleeding means hypovolemia, BP is also less here, hypotension, and the tachycardia. So obviously the answer, or which type of shock it is, it is an, it is a hypovolemic shock. So which is the right answer here? Hypovolemic shock. Okay, so hope you understood the concept of hypovolemic shock, because this is a very important. You may expect a question like this only. They may give a case scenario or the a case description, and they will ask you what type of a shock it is. Okay, so next, coming to the second question here. A patient with a myocardial infarction develops hypotension. See here conditions, what are they have given. A patient is with the myocardial infarction and develops a hypotension, and the cold clammy skin and decreased urine output. What type of shock is suspected here? Again, the options are cardiogenic, septic, neurogenic, and the anaphylactic shock here. See here in the cardiogenic shock, see here in the, as the name, myocardial infarction, so that usually that name itself takes you to the option that is cardiogenic shock. Obviously the answer is cardiogenic shock. So let's see what actually happens in the cardiogenic shock. See, in the cardiogenic shock, cardiogenic, so the name indicates cardiogenic, means this shock is majorly related to the cardia, means that is due to an heart problem or the improper functioning of the heart. So what is the major function of the heart? That is to pump the blood. So means here the heart is unable to pump the enough blood. Because of that, the tissues are getting the less blood supply, there is decreased tissue perfusion. Again, the same thing will happen as we seen in the hypovolemic shock. So the major problem here is heart is unable to pump out the enough blood. Okay, means there is a decreased cardiac output. So in which conditions we can see the decreased cardiac output? So the most common cause for the cardiogenic shock is the MI, myocardial infarction. So do remember this, the most common cause is the myocardial infarction. So very important. So you may get direct question, which is the most common cause for the cardiogenic shock. So your answer should go for myocardial infarction. Okay, so hope this is clear. So in this, what happens actually here, as I told, myocardial infarction, in the myocardial infarction what happens, there is a death of the myocardial cells or the myocardium because of the reduced blood supply to the myocardium. So the myocardia, the muscles of the heart get, muscle tissues of the heart get destroyed, or there is an necrosis, or the death of the myocardial cells will happen. Because of that, the heart is unable to pump the blood and there is a decreased cardiac output. See, because of the MI, there is a decreased cardiac output and decreased tissue perfusion. Okay, decreased tissue perfusion. Again, there is, when there is decreased blood supply, the same thing as we seen in the hypovolemia, the same thing will happen. There is an decreased O2 supply to the tissues and leading to anaerobic metabolism. Okay, and even the blood or the heart starts pumping more as in compensatory mechanism. There we can see the tachycardia, and even as there is a decreased cardiac output, we can see the hypotension as well. Okay, and the cold and clammy skin. So all these symptoms are there. Then how do you differentiate the hypovolemia and with this cardiogenic shock? See here, the two things importantly you should note. In the hypovolemia, there is a decreased blood volume, but here in the cardiogenic shock, there is no volume is being affected. Okay, the volume of the blood is same, or there is no any changes with the blood volume, but the problem is with the heart. So heart is unable to pump the enough blood because of the death of the myocardial cells or the MI. So because of that, the tissues are getting the less blood supply, or because of that, there is a decreased tissue of perfusion. So the problem is with the heart pumping function and not with the volume of the blood. See, that is the major difference between the cardiogenic and the hypovolemic shock. So here the symptoms, again the clinical features what we see are the same thing: hypotension, tachycardia, and the cold clammy skin, but the volume of the blood remains same, or there is no any changes with the blood volume, and it is problem is with the heart of functioning. Okay, so here then what is the management aspect for this cardiogenic shock? See here, the cardiogenic management, cardiogenic shock will be managed with the inotropes. Management will be done with the inotropes. Commonly used is the dopamine. So dopamine is being used. This will help to improve the cardiac output and improves the BP as well. So this is what the cardiogenic shock. See here in the question, what they are asking is a patient with the myocardial infarction. Okay, so this name itself will take you to the, it is a cardiogenic shock, and patient has an hypotension here, cold and the calm skin, and decreased urine output. See here another condition they have given is a decreased cardiac output. So as I told, there is a decreased cardiac output, so all the organs will get the less blood supply. So the kidney is the major organ where it receives the maximum amount of the cardiac output, and as there is a decreased cardiac output, automatically there is decreased GFR and decreased urine output. Okay, so even this can also be seen with the hypovolemic shock also, because there is a decreased cardiac output is also there because of the less blood volume, and the kidneys are also getting the less blood, and urine output is definitely it is decreased. So there you can see the oliguria, and sometimes even in the later stages anuria can also be seen if there is a massive bleeding or heavy hemorrhage is there. So this is urine output will be a good indicator. Even in the, it will help you to identify or indicates the effectiveness of the treatment in the hypovolemic as well as in the cardiogenic shock. Okay, so this is what the things they have given in the question. There is a decreased urine output, hypotension is there, cold and calm skin is there. So then your answer here is the, that is cardiogenic shock. So this is the right answer. Okay, so hope this cardiogenic shock is clear, hypovolemic and the cardiogenic. So the next question here is, okay, so the third question here, a patient develops sudden wheezing, hypotension, swelling of lips after receiving the penicillin. What type of shock is this? See here the in the question what they have given is, the patient has developed the sudden wheezing, and there is an hypotension, and even there is a lip swelling after receiving the penicillin. So means in the case what it is given, the patient has received the penicillin injection or the penicillin drug. After that he has developed these kind of symptoms. Wheezing has developed, hypotension has developed, and there is a lip swelling is also developed after taking the penicillin or receiving the penicillin. So it clearly suggests, this case clearly suggests it is an allergic to the penicillin. Okay, these are the allergic reaction, or the patient is sensitive towards the penicillin drug. So that has given you these kind of symptoms. So what type of shock it is? See, if you can use the common sense over here, the septic usually, as everyone knows, septic means it is an infection. Usually they this word will give the meaning of infection. Hypovolemia, that I have already explained here. Then cardiogenic, that I have already explained in the second question. And the last option left is the anaphylactic. So all you might have heard the anaphylactic reactions or the type 1 reactions. Hope you all studied in the microbiology the type 1, type 2, type 3, type 4 reactions, hypersensitivity reactions. So in that the anaphylactic reactions comes in the as a type of, that is the first type, that is type 1 hypersensitivity reactions, or these are also called as IgE mediated hypersensitivity reactions. Okay, so the all these will indicate this is an allergy. So the right answer is, here is the anaphylactic shock. So come, let's discuss a little bit about the anaphylactic shock. See what actually the anaphylactic shock is. See, as the name suggests, anaphylactic means where there is an systemic hypersensitive reactions occurs that leads to the shock symptoms. Shock symptoms in the sense that is, you can see the hypotension, then tachycardia can also be seen, then cold and calm skin. What are the symptoms that we have seen in the hypovolemic cardiogenic shock? The shock symptoms are majorly seen. That is not because the reason is here different, that is due to an hypersensitivity reactions or due to an allergic reactions. See here, anaphylactic shock, it is a type 1 IgE mediated hypersensitivity reactions. So what it is? So it is anaphylactic shock. The anaphylactic shock, it is a type 1, very important, type 1 IgE mediated, IgE mediated hypersensitivity reaction, sensitivity reaction. Okay, so very important, you may get a direct question on this. So what are the type, what this anaphylactic reactions are? These are the type 1 IgE mediated hypersensitivity reactions. So that is the first thing you should remember. So these are the systemic hypersensitivity reactions. See, actually what happens here during the allergic condition. See, whenever the person is exposed to the some allergens, so allergens may be like it may be an medication. Okay, many patients are allergic to some medications, especially the penicillin group of antibiotics or any antibiotics you can take. Okay, so allergens here we consider as the drugs or the medications, and the patient might be allergic to some food. Okay, say for an example seafoods, the say patient may be allergic to seafoods. Then allergic reactions may occur due to an bite of insects like a honeybee sting or the snake bite or the scorpion bite. All these can also lead to the anaphylactic reactions, and it can be due to some dye or the contrast that we used in the diagnostic aspects like the iodine dye. Okay, the contrast that we use for the like MRI contrast or the CECT, where we use the contrast or the dye, a patient may have the allergic to those dyes or the contrast as well. And even the food, as I told, then the dust, okay, pollen grains or the animal what we call like animal hairs or the dust, pollen grains. So these might also cause initiate the allergic reactions in the patients. So all these were called as the allergens. They will initiate these allergic reactions. So when these antigens, allergens are considered to be the antigens, these will go and attach with the antibodies which are being formed in the, that is IgE antibodies, which are present over the mast cells and the basophils. Okay, where we find this IgE basophils and the mast cells. So these will go and attach to this basophils or the mast cells, and the antigen antibody reactions takes place, and it gives rise to, or there is a liberation of those so many chemical mediators during the reaction. Okay, so what chemical mediators will get released? So there is a release of the leukotrienes can be there, histamines can be released. So all these will lead to the these effects or the pathological changes. So let's see what actually happens here. So when this antigen antibody reactions takes place, the chemical mediators or the inflammatory mediators or the these mediators which are released by the mast cells and the basophils leads to the vasodilation. So there is an massive vasodilation will be there. So because of that, the blood, or there is an increased permeability, because of that the plasma leaks from the blood vessel, and the volume get reduces and the fluid get accumulated in the peripheries. So this is what we call it as a, so means here the blood is been poured in the periphery, so it is widely distributed in the periphery, the blood is widely distributed in the periphery. That is why this anaphylactic shock is considered under the distributive type of a shock. Okay, see here in the pathology, you should, what you should remember is the, that is the allergen will act on the, this will come and attach to the IgE, that is antibodies, which are present on the mast cell, mast cells and the basophils. This is also very important, you may get a direct question over here, allergen with the IgE. So there it releases the some chemical mediators, chemical mediators, mediators like histamine, Okay, then leukotrienes, cytokinins. So some these chemical mediators are being released. So these will act on the blood vessels and causing the excessive vasodilation. And because of the vasodilation, the plasma gets seeps into the extracellular spaces, and the blood volume get reduced. The intravascular fluid or the volume get reduces. Okay, so here there is a vasodilation. So because of the vasodilation, there is a decreased peripheral resistance and the blood pressure goes down. That is what we call as hypotension. And as there is an increased capillary permeability, the plasma leaks into the blood tissues, from the blood vessels into the tissues, and causing the edema. Okay, so edema will be there. So it will leads to the edema, and the volume get decreases, and leading to the means there is an less blood will be taken to the heart, or the volume get reduces, and the cardia or the heart receives the less volume because the blood is being pulled into the peripheries. So that is why it is called as a distributive, means there is an abnormal distribution of the blood in the periphery, and hence it is called as a distributive type of the shock. So here hypovolemia there, and these histamines, leukotrienes, these will causes the bronchoconstriction. So these will act on the smooth muscles in the bronchi and leading to the bronchoconstriction. Because of the bronchoconstriction, the patient will have a wheezing, dyspnea. Okay, this is very very important. So the smooth muscles make get contracted in the bronchi, leading to the wheezing and the dyspnea, and even it will causes the laryngeal muscle spasm. There we can see the airway obstruction as well. So if the patient is having these kind of symptoms, it is considered to be the severe anaphylactic reactions. Okay, so along with that, the patient, this will also increases the histamines will also increase the mucus secretions, and these mucus get accumulated in the respiratory tract and again further blocking the airway. So this can also be there, excessive mucus production, and as there is a decreased blood volume, the oxygen delivery to the tissues will also be less, and hypoxia can be there, and the organ failure can also be seen. So along with that, as it there is an allergic reactions, so you can see the allergic reaction, especially there is a flushing of the skin, means the blood is being flushed into the peripheries, so leading to the redness. Okay, so redness can be there, and we can see the angioedema means the lips will get a swell, or there is a swelling of the lips can be there, and periorbital swelling can also be there. So these kind of symptoms are there, so then it definitely indicates the anaphylactic reaction. So if any patients comes with the history of these kind of symptoms like urticaria or the pruritus, then angioedema, all these symptoms after receiving any kind of a medication or after consuming any type of food, so then you suspect for, or it is and definitely a case of the anaphylactic reactions. Okay, so you may get an image based question on this also, so very important. You might get a direct question on this image based question. Okay, this is a angioedema where you can see the lip swelling, and here we can see the flushing or the urticarial rashes over the skin can also be seen. So this is all about the anaphylactic shock. See here also the patient is having the symptoms like shock symptoms. What are there? Hypotension is there. Okay, and as there is a decreased cardiac output, and the patient may have tachycardia, again tachycardia is there. Initially, as there is a blood is being pulled out, so you can see the warm will be there, and later it will turns to an cold clammy skin. Cold clammy skin. Okay, the BP get reduced, heart rate get increases, cold and clammy skin. Along with that, some skin changes you should note very importantly. Skin changes as I told: urticaria, pruritus, then angioedema. Angioedema means that is swelling around the lips, and even though a facial swelling or the puffiness can be seen in the patient. So if these symptoms were present with the history of, like, these symptoms get developed after, along with that, the patient is having the respiratory obstruction symptoms like wheezing, then excessive mucus production, then laryngeal edema. If there is a laryngeal edema, then the patient might be not able to speak, or there is severe obstruction in the airway can also be seen. So dyspnea, then cyanosis, all these symptoms can also be seen. That is a very severe cases, will be, we can see those symptoms. So this is all about the anaphylactic shock. See here in the question, a patient develops a wheezing, hypotension, lips after receiving the penicillin. So definitely it is an anaphylactic shock. So let's move on to the next question. Okay, see here, a patient with a severe infection. Okay, a patient with a severe infection develops fever, hypotension, fever, hypotension, and warm flushed skin. Which type of shock is most likely? See here the symptoms are given. The patient is with the severe infection, okay, has developed the fever, hypotension, and warm flushed skin. See here this word severe infection, so that itself take you to the right option here. If you use some common sense, then patient is having the hypotension here and fever because of the infection, and there is a warm flushed skin. So which type of shock is most likely here? See here in this, the patient is having the severe infection. The severe infection means it is again obviously the septic shock. So this is a case of a septic shock. The right answer here is the septic shock only. So let's see what actually the septic shock is. So the name septic. Septic means it is a systemic infection, means there is an increase of bacterial or the viral load in the systemic circulation or in the blood. So that is what we call as a septicemia. So if the because of the severe systemic infection, our immune system started reacting in an hyper way, means there is an hyper immune system response can be seen. In order to combat or fight with the infection, our immunity start responding in a very hyperactive way, so that the infection get reduces. So because of the hyper response by the immune system, there is then release of the inflammatory mediators during this infectious condition or during the systemic infection. So this release these inflammatory mediators, they causes the abnormally vasodilation. Okay, so here in this, what happens in the septic shock, what actually the septic shock is, it's a life threatening complication of sepsis characterized by persistent hypotension and tissue hypoperfusion, even despite of the adequate fluid resuscitation. It is due to an systemic infection. Okay, when there is an increased bacterial load or the viral load or the micro the disease causing factor in the systemic circulation, there we call it as a sepsis. So because of that, the patient develops a hypotension and there is a decreased blood supply. Even after adequate fluid resuscitation, these symptoms will not improve. So there it is called as a septic shock. So as I told, so when the infection enters into the bloodstream, that is what the sepsis we call. So because of that, these pathogens or the bacteria or the virus, they start producing the toxin, and to those toxins our immune system responds by releasing some inflammatory mediators like cytokinins, nitric oxide. See, all these will act on the blood vessel and causing the massive vasodilation. So because of the vasodilation, there is an increased permeability, the blood volume get or the plasma get seeps into the extracellular spaces, the blood volume get decreases, and the cardiac output, means the venous return is also reduces, cardiac output is less, oxygen supply to the tissue is less, hypotension, tachycardia. Again, all these symptoms of the shock will be seen with the septic shock. So initially, as there is a massive vasodilation and capillary leak is there, the blood get pooled in the peripheries. Okay, so where the initially in the initial stage where we can see the body is very warm, so there it is called as a warm stage, and later it will turn to an cold, that is because of the hypotension and the reduced blood supply. The later periphery get cold. So initially warm stage will be there, and then later it will turn to an cold stage. So two stages can be seen here in the septic shock. You must remember, initial stage is the warm stage and the late stage is the cold stage. So as there is a decreased cardiac output is there, and abnormal wide distribution of the blood will be there, then cardiac output is less, the organs are getting the less blood supply, and finally this septic shock will leads to the MODS, that is hypotension. These all will leads to an this all will leads to an MODS. So MODS means multi-organ dysfunction, or the multi-organ dysfunction syndrome. Okay, that is, or means the organ gets a failure because of the reduced blood supply. So the what is the treatment here is, that is majorly we have to improve the cardiac output by giving the some vasopressors. So the drug of choice here is the vasopressor, that is norepinephrine, or we call it as a NORED, or the noradrenaline. And the next is we have to high fluid resuscitation to be done. So this is the first management. First we have to improve the fluid volume. Fluid volume we have to increase, and we have to start with the NORED in order to improve the, or it will increase the peripheral vascular resistance, and thereby improves the BP, and thereby improves the venous returns to the blood. So this is how the noradrenaline works. Okay, so the here the patient will ends up with the MODS, multi-organ dysfunction syndrome, or the organ failure will be there in this condition. Okay, so the next here is the another question. A patient with the spinal cord injury develops hypotension and the bradycardia. Which type of a shock it is? See here, the patient is having the cord injury, spinal cord injury, and develops an hypotension, and bradycardia is here. And what type of shock it is? So again, the septic shock, cardiogenic, neuro, and the hypovolemic. So we have already discussed this, what is septic shock, cardiogenic shock, and the hypovolemic shock, and the options left is the neurogenic shock. And here there is an uh, as the name suggests, neurogenic means it is generated, or it is been from the neurogenics, or the neural side, means the from the nervous system, because of the hampering or the functioning, improper functioning of the nervous system leading to the shock symptoms, and that is what we call as a neurogenic shock. See here, the spinal cord injury has been taken place here, and because of that the patient is having the shock symptoms, that is hypotension and bradycardia. See here, two things are they have given here is, one is a hypotension, and here it is bradycardia. In all these shock types, we have seen hypotension and the tachycardia, but here we have there they have given the hypotension and the bradycardia. So what is the, then is it a shock? Patient is having the bradycardia, not the tachycardia. Why this bradycardia is seen in the neurogenic shock? So let's discuss about the neurogenic shock. So what actually the neurogenic shock is? So the neurogenic shock, see, it is a distributed type of shock caused by loss of the sympathetic nervous system. Means whenever there is a damage to the spinal cord occurs, especially above the thoracic level 6, so the sympathetic nervous system get damaged, and leading to the severe vasodilation, hypotension, and the bradycardia. So sympathetic nervous system will help for the, means it will properly maintains the cardiac function or the heartbeat. So when it get damages, then automatically the heart rate get reduces. There we can see the bradycardia. Okay, the vagal stimulation will be there, so that will causing the bradycardia. And here there is no any compensatory mechanism for this sympathetic nervous system damage. So once the sympathetic nervous system get damages, there is no control over the parasympathetic nervous system, and hence it gets overly reacted and causing the hypotension, bradycardia. All these symptoms will be seen. So do remember hypotension, bradycardia. So this is a very peculiar and the differentiating feature from all other shock with the neurogenic shock. So hypotension and bradycardia, your answer should go for neurogenic shock. So do remember these two things. Very important. So this is a neurogenic shock. Okay. So hope this is clear. And very importantly, it occurs especially when there is an injury to the spinal cord above the T6 level, means thoracic 6 level above. If the spinal cord get injured, then we can have the neurogenic shock. So what are the most common causes? So the most common cause, as I told, it is spinal cord injury is the most common cause for the neurogenic shock, especially the above the T6 level. So apart from that, if the patient gets a spinal anesthesia, or if there is a severe head injury or the cervical spine injury, so all these can also cause damage to the autonomic nervous system and causing the neurogenic shock. So do remember which is the most common type or the most common cause for the neurogenic shock is spinal cord injury. Okay. So here, so what will happen actually here? So as I explained, there is an injury to the spinal cord that interrupts the sympathetic pathways, and means there is a loss of the sympathetic pathway or the sympathetic system, and leading to the vasodilation. Because of the vasodilation, and there is a decreased systemic vascular resistance because the blood gets distributed in the peripheries, and blood pools in the peripheral vessels, and that is why it is called as a distributive type of the shock. Okay. And there is a reduced venous return. Because of that, there is a decreased cardiac output, and that will result in the decreased tissue perfusion and hypotension. So these are the, and as I told, there is no any compensatory mechanism over here. There is sympathetic nervous system fails, but parasympathetic nervous systems, it works as like there is no any problem. Okay, it does it work, but the sympathetic nervous system fails here. So this sympathetic and the parasympathetic nervous system, they work in collateral, means side by side, then only there is an hemostasis. So if one system get fails, if this system works in its way, then the symptoms related to the parasympathetic will we can seen, that is the vagal stimulation can be seen. So that is bradycardia is the major symptom what we see in this condition. So that is why the hypotension and the bradycardia is the classical sign of the neurogenic shock. Okay. So what symptoms we have here? That is hypotension, bradycardia, and warm and the dry skin can be seen. See, because why there is a warm and dry skin? Because the blood get pooled in the peripheral vessels and leading to warm and the dry skin, and decreased cardiac output will be there. Then what is the management here? So we have to manage. So here we have to remember the ABCD in all the shock. We need to remember the management A, B, C, D, E. Okay. So A stand for the airway, establishing the airway. In the case of a spinal cord injury, we need to stabilize the spine first. Okay. So cervical spine should be protected and it should be stabilized. Immobilize the cervical spine by an collar, neck collar can be used, or spinal board can also be used. So during the, that is for establishing the airway. Then B stand for the breathing. Breathing should be established by adequate ventilation or by the oxygen supply. Then C stand for the circulation. So we have to control the circulation. In that we need to have a control over the hemorrhage and all. That all things we have to. Then IV fluid administration. All this will comes in the circulation. Then D stand for the disability management or the disability, controlling the disability. In the case especially the neurogenic shock, we have to assess the nervous system properly to reduce the disability. And E stand for the, that is prevention of hypothermia or the exposure to the environment. So the hypothermia is the most common complication with all these shocks, because the anaerobic metabolism, the ATPs are not being generated properly, so the patient will go for the decreased metabolic activities and leading to an hypothermia as well. Okay, so these are all the conditions, and even exposure to the environment can also lead to the hypothermia. So this has to be focused in the management. So this is in the neurogenic shock. Again, we use the vasopressors, that is norepinephrine, noradrenaline, and the dopamine. And if the patient, as I told, that there is a bradycardia, so atropine should be given. So what is the dose of atropine here? So atropine should be given 1 mg. Okay, so 1 mg dose of atropine should be 1 mg will be given. So if the heart rate will not improve even after giving the atropine, so you can repeat it after 3 to 5 minutes. 3 to 5 minutes we can repeat. Okay, so maximum dose we can give 3 mg. So 3 times we can repeat the atropine. So then that is what the atropine doses to treat the bradycardia. So the next question here is the, a nurse observes restlessness, tachycardia in the trauma a patient. What stage of shock is indicated? So means the patient is having here restless, is restless and tachycardic, and in the trauma what stage of shock it is. See here they have given the condition like a trauma, so means the patient is having, might be having the neurogenic shock may be there. A neurogen, it is not a neurogenic because the tachycardia is there. Okay, we can expect the hypovolemic shock here. The patient is hypovolemic shock because of the trauma, and patient is restless. So what is the stage of shock they are asking? See here, because of the hypovolemic shock or the hemorrhagic shock will be classified in different stages. You can see this chart here. It has been classified majorly. This is as per the ATLS, Advanced Trauma Life Support. They have classified this hemorrhagic shock into an class 1, class 2, class 3, and the class 4. So in the class 1, what is class 1 here? The class 1 where we can see the blood loss is around less than 750 ml or less than 15%, and the pulse rate is less than 100, and the blood pressure is normal, capillary refill is normal, respiratory rate is also within the normal, and the urine output is also more than 30 ml. Okay, so this is all what we call it as a class 1 hemorrhagic shock or the class 1 hypovolemic shock. So in this the treatment aspect will be crystalloid, means it is slightly, the means the volume loss is a minimal or very less. And the class 2 here, in this condition there is a blood loss of 750 to 1500 ml, means 15 to 13% of the blood loss will be seen, and around the pulse rate goes more than 100 to 120, means the patient is tachycardic here, and we can see the pulse pressure is decreased, capillary refill is decreased, and respiratory rate is, again the patient is tachypneic, 20 to 30 rate is here. Okay, the urine output is also start reducing 20 to 30, and patient becomes anxious, and here the option for treatment is the crystalloids. Crystalloids means uh, crystalloids we can give, that is the IV fluids we can give. See here tachycardia, so this class 2 we call it as a compensatory stage. Compensatory stage. So means here the patient is having the tachycardia and the urine volume get decreases and patient becomes anxious. That is what the restless he will become. So this is in the question what they have given here is the patient is restless, tachycardic. Okay, two things they have given: tachycardia is there and the restless is there. So it is obviously it is a stage of compensatory stage. See, then in the class 3, there the volume loss will be around 1500 to 2000 ml. 30 to 40% of the volume will be get lost, and the tachycardia, severe tachycardia, 120 to 140 heart rate is there, blood pressure is decreased, and pulse pressure is also decreased, and urine output is also decreased to 5 to 15 ml per hour, and patient is anxious, and crystalloids and the blood need to be transfused to treat this kind of cases. So this class 3 it is also called as a decompensated stage. Okay, and the last stage is the class 4, where we can see the severe blood loss more than 2000, and more than 40% of the blood loss is there. Very severe tachycardia, more than 140 heart rate can be seen. Then pulse hypotension, pulse pressure is decreased, capillary refill is decreased. Then more than 35 heart rate, respiratory rate can be seen. Then urine volume or the urine output is completely nil or maybe negligible urine output, and patient is confused and lethargic. So in this stage is called as a refractory stage. This is called as a refractory stage. So in this there is no reversibility of the condition. The patient will go for the MODS, that is organ failure can be seen with the refractory condition. So in the compensatory, where the compensatory mechanism start activated, patient will have a tachycardia. Okay, hypotension will not be there. Okay, hypotension will not be there in the tachycardia in this condition, but patient becomes anxious. But in the decompensated stage, there is tachycardia, hypotension is there in the decompensated stage, and in the last stage, refractory stage, there is no reversibility of the condition. The patient organ failure can be seen. So what is the management for the refractory stage, where the patient needs the massive blood transfusion or the fluid and resuscitation? Okay, so this is all what about the classification of hemorrhagic shock or the stages of the shock. See here in this condition, they have given the restlessness and the tachycardia. So it is a stage of compensatory stage. Compensatory stage of a shock. Okay. So in the next video, we will discuss a few more questions related to the shock.